Through President Trump's rollback on birth control, employers now have the freedom to incorporate their religious and moral views when deciding the healthcare coverage of their employees. And students involved in more conservative political groups on campus commented on the new policy.
I think this gives us more freedom, and it gives businesses more freedom. And if employers decide to ban or choose insurance that does not cover birth control, then the market will balance itself. Maybe employees will go work for someone else. And at the end of the day, it balances out and gives us more freedom.
We do think that everybody should have access to those things, and women deserve those products, but at the same time, a product or service isn't guaranteed by anyone from the government or insurance.
So if you're talking about, let's say, should they cover birth control or not? Some companies that want to, they let them. And those who don't want to because of their religious beliefs, then they shouldn't have to.
Advocates for free access to birth control also commented on the mandate.
We at the center view it as a rollback. It's a removal of agency for folks, specifically marginalized folks, to seek access to agency over their bodies.
It's an attack on reproductive rights under, this mask of, religious freedom, but that's exactly it. It's not a separation of church and state. They're making these policies based around a religious exemption.
This is much more than an attack on women. This is an attack potentially on minoritized populations like trans and gender nonconforming folks. It's a class issue. There's folks who need access to these that are not cisgender women. And so I think thinking about holistically what folks are losing access to, it goes further than contraception for preventing pregnancy.
College women across the United States are worried that their university's health insurance may drop access to contraceptives. Although it is unclear if Colorado State will be affected by this rollback, students like Katie Rochat from the University of Notre Dame say college women don't always have a disposable income to afford birth control on their own. Rochat says, "I respect my university's adherence to Catholicism, but I also think that no woman should have to choose between her serious medical needs and her university's religion."